about declining empires is that they reek of arrogance and tend to look down upon others. The irresistible urge to mock and ridicule others is what signals the downward trajectory of a declining empire, like this disgusting cartoon that was published by the New York Times. You will often find New York Times mocking or ridiculing India. But what about the US itself? While New York Times has yet again shamed India, the US itself is in the middle of a major crisis. Hi and welcome to TFI English, the national and socio-political analysis arm of the TFI Media Group. I'm your host Isha, and in this video I will tell you why NYT prioritizes shaming India while the US faces a devastating COVID surge. Let's begin. New York Times is shaming India over a make-believe report about people in India not wearing masks. But this is rather strange. I mean, the US itself is in the middle of an unprecedented blood crisis, and all New York Times wants to do is to find ways to shame India. On Monday, New York Times published a report titled, "In India, mask wearing is down even as case numbers rise." The report claims, after the deadly wave of COVID caused by the Delta variant in India last year began to recede, mask wearing also declined. Crowded markets and tourist destinations again filled with people, mostly unmasked and not social distancing. It also seemed to take a jibe on the ongoing election season. The American newspaper stated, as coronavirus cases started increasing in urban centers, Prime Minister Narendra Modi told residents to be vigilant, and the Chief Minister of Delhi, Arvind Kejriwal, imposed a curfew among other measures. But with the opening of election season a month off, both leaders have been seen campaigning in states that are going to the polls, holding rallies that packed in thousands of people, lots of them without masks. New York Times is strangely talking about a COVID surge in India. It stated, the Indian Health Ministry reported 1,79,723 new COVID cases on Monday, the highest number since May, and identified approximately 410 new cases of the Omicron variant. Now, how hypocritical is that? New York Times is concerned about the number of cases in India, whereas the US itself recorded a staggering 1.35 million cases on Monday, the highest daily COVID-19 infections recorded by any country in the world. Over 136,604 people are hospitalized in the United States, indicating the severity of the pandemic situation in the country. The American Red Cross has said that the US is facing its worst blood shortage in over a decade. There is a sharp drop in blood drives due to the pandemic, which is reducing the amount of blood supply to medical facilities in the country. The pandemic has led to a 10% decline in the number of people donating blood. Blood donation drives in schools and colleges too have gone down by 62%. Baya Lasky, medical director for the Red Cross, said, winter weather across the country and the recent surge of COVID-19 cases are compounding the already dire situation facing the blood supply. Lasky added, please, if you're eligible, make an appointment to give blood or platelets in the days and weeks ahead to ensure no patient is forced to wait for critical care. The American Red Cross said that dangerously low supplies are compelling doctors to make difficult decisions as to who gets blood transfusions. So the COVID-19 situation in the United States of America is so bad that people are dying, not just because of infections, but also because of a lesser blood supply. The Red Cross has disclosed that almost a quarter of hospital blood needs aren't being met. This creates a huge problem, especially in the case of rare type O blood supplies. The Red Cross has stated that it has had less than a one-day supply of critical blood types. Now this is really strange. I mean, who would have imagined that the pandemic would lead to empty blood tanks? But this is happening in the United States of America. Yet all that New York Times wants to do is to shame and mock India.